on the pandemic. Dr. Kasai, over to you.
Thank you very much. 6 months into this outbreak, we reached the green milestone of 10 million people infected and 500,000 lives lost worldwide. The pandemic is now hitting lower resources countries with fragile health systems that are less equipped to contain the virus. Infections are accelerating in many parts of the world. But in our region, most countries are seeing case numbers stabilize or decline. Some have had no new infections over a month, and most Pacific islands have yet to report a single case. Although the number in the Western Pacific are smaller than other regions, the impact of this pandemic has been huge for families, societies, and economies. We also know that people everywhere are anxious and fatigued. But there is really no room for complacency. There is still plenty of space for the virus to spread in this region. In this interconnected world, as long as the virus is circulating somewhere, no country is safe. We must continue responding to the current situations and preparing every corner of every country for the possibility of large-scale community transmission. And here's what we think is important to achieve this. The tactics used by many countries in our region, early detection, isolations, and treatment, and aggressive contact tracing and mobilizing the public have kept large-scale community transmission at bay so far, but now they need to be expanded nationwide and strengthened further. Countries need health facilities with enough space and equipment to care for people who are severely sick, and intermediate facilities for those who don't have severe diseases. We need to make sure systems are prepared to protect those who are most vulnerable, such as those living in the care homes and communities with crowded living conditions and lack of sanitation. We also need to bring other routine health services back, like vaccinations, treatment for tuberculosis, and care for cancer, diabetes, and heart diseases. And importantly, we need to make the new normal common practice. The virus depends on human-to-human transmission to survive. So every individual has the power and the responsibility through their actions to protect themselves, their family, friends, and colleagues, and health workers and the vulnerable in their communities. And this new normal isn't about prioritizing either health or livelihood. It's actually about improving both. And decisions about how to do this in different contexts need to be based on data, and they need to be made by bringing together the health sector, economic sector, and community at one table. If we do this well, we can protect ourselves and each other from diseases, but also other threats. And we can grow from the new normal to a new future where health is recognized as an investment, where healthy people in our communities have their full potential, achieve their full potential, and where inequalities are minimized. This is good for all of us as individuals, but also for our economies and societies. This new future is the dividend of COVID-19, which WHO hopes for. We are now at a decisive moment, and we must stay vigilant and keep preparing for further surges of the virus so that together we make our way to a better future. Thank you very much.
Thanks very much, Dr. Takeshi. Just a reminder to everyone on the call, if you can use the Q&A function rather than the chat for us, that helps us to filter the questions that you might have for our panelists. This obviously is not just a health crisis, it's an economic crisis. We have the Director General of Sustainable Development and Climate Change with us from the Asian Development Bank, Woo Chong. Mr. can you tell us a little bit about what the Asian Development Bank is doing in the context of the current crisis?
Thank you very much. You can hear me okay?
Yeah.
Yes. Yeah, as Dr. Kasai said, this pandemic has caused havoc on everyone, and COVID-19 continues to spread globally, weighing heavily on the economies and lives of people. Based on our recent estimates in May, COVID-19 would cost around global output of $5.8 trillion, which is equivalent to about 6.4% of global GDP. That's under the assumption of 3 months containment. But it goes up to 8.8 trillion if it goes up to 6-month containment because of the border closures and lockdowns of large chunk of economic activities. So this has a huge impact on our economies. And in Asia in particular, it accounts for about 30% of the decline in the global output, with the output in the region falling up to 2.5 trillion equivalent, or up to 9.2% of the regional GDP. So this COVID-19 impact assessment implied that the pandemic will reduce developing Asia's growth to just about 0.1% this year, its lowest in the last 6 decades. While the GDP is projected to grow by 6.2% next year, that looks like a large number, but it's actually because the growth is projected calculated relative to this year's low base. So it looks likely that the recovery will be more like a V-shaped recovery, will not complete, or will not be a V-shaped recovery. So the pandemic has spared no economy in the region, and all of the ADB's developing member countries and economies have seen downward revision of growth in 2020, and most of our developing countries are expected to contract this year. So the key issues, the lockdowns and the prolonged lockdown measures hit wholesale and retail trade, accommodation and food services, and transportation sectors, which are affected severely in the Asia and the Pacific region, which accounts for about 14% of the total employment. Manufacturing, which accounts about 16% of the total employment, such as automobiles and textiles, clothing, leather, and footwear, among others, has also suffered severe domestic and global value chain disruptions. So this all translates to employment losses and are expected to be as high as 167 million in Asia, accounting for about 70% of the global job losses. And more disconcerting is the finding that the most vulnerable sectors in the economies are economies comprising of unskilled workers, small and medium enterprises, and informal sector, and women will be the hardest hit. They will be heavily affected as the economy impacts are heaviest on the retail sector and the recreation and hospitality sector, tourism, transportation, and aviation, which are quite labor intensive, with heavy reliance on women as well as input from small and informal businesses. Many migrant workers also have lost their jobs as key host economies such as the Europe, US, Middle East also struggle with the outbreak. As a result, 34 developing countries with data in our region, we observe huge decline in the consumption, which could translate to a number of poor people living below the extreme poverty threshold of $1.9 per day to increase by 56 million people. So bottom line is that we have a lot of work ahead of us to make sure that the Asian economies are back on track. So to address this, ADB has provided rapid support since the very early stages of the COVID-19 outbreak back in January. That included $70 million of grant resources to approximately 40 countries to help its developing member economies to take immediate action to respond to outbreak. Initially, basically to flatten the curve. And then on 13th of April this year, our board of directors approved $20 billion package for emergency economic budget support, as well as building back better initiatives. We must not forget to build back, keeping in mind the overall sustainable development objectives, including the climate change and green development. So bottom line is we have a lot of work to do, but I believe that we can do this together. Thank you.
Thank you very much. You mentioned, as you were speaking, the impact of this crisis on some of the most vulnerable people in societies across Asia. One of the organizations that works with those people is Friendship Bangladesh, and its founder and executive director, Runa Khan, joins us on the call. Runa, can you tell us about some of the things that have worked from your organizational perspective in coping with the current crisis? Please unmute yourself if you could, Runa. Thank you.
Thank you. Thank you very much. I'm very pleased, Adrian, to be here with all of you. So Bangladesh is a country, which is in the forefront of climate disasters. The mass of our population gets to deal with life and death several times a year. It's a very thin thread, and we are aware of that. It's not a rich country, it's a country which is the most densely populated country in the world with a very poor infrastructure of health, education, and other basic services. So it's 170 million people. The number of tests we have done so far is 769,000, approximately 500. Out of which 145,500 cases have been tested positive, which is 19%. But that's not the reflection of the reality, as mostly if you are kind of suspected cases, then you are tested. And our highest death rate was yesterday, which was 64. Immense life drama is happening daily in Bangladesh. We are simultaneously handling the pandemic, the cyclone, the climate disasters which we have annually, Cyclone Amphan, floods which have already started early this year, overflowing villages and towns, devastating livelihood and endangering life. And amidst all this, all amidst this crisis, the COVID crisis, and whatever the cause, each life is a life and it matters. So how are we surviving? I think one of the things that Bangladesh has done is it has not politicized the pandemic. I think that has been a big strength for us. It has not been us versus them. We are all in this together, different elements of the government, politicians, community, the social entrepreneurs. And dealing with this threat of life and death is a reality for us. Thus, we have an incredible resilience, people of kind and courageous communities. We took in 1 million refugees a couple of years ago. And Friendship, which I founded about 20 years ago in Bangladesh, is an international SPO, which is a social purpose organization. 100% of our work is with communities who are impacted by climate, and they are in the poverty-stricken areas. Either climate refugees like the IDPs, or they are the political refugees like the Rohingyas. The disaster-prone and poverty maps of Bangladesh, you will see, is 100% is overlapping on all our work. And what we do is we strengthen the communities themselves to deal with this disaster. This has been our learning because there is no alternative for this. And, we are known as the pioneers of the first ship hospitals in Bangladesh, NGO hospitals in the world. We have a 3-tier healthcare system which leaves no one behind. We cannot afford to leave anyone behind in these areas. And global health, cannot be limited to only healthcare. And thus our mandate has been in saving lives, climate adaptation, poverty alleviation, and empowerment. And with this, in these regions, we are serving about 6.5 million people directly, service delivery every year. From ensuring that the mangroves, are there for climate mitigation, and we are the largest private sector initiative in Bangladesh for this, to preparedness, relief, rehab, extensive training is being given, before we let communities access funds, children education, adult education, high school, and also online education. And finally, we link the communities to the mainstream structures because this is how they get their dignity and independence for survival. And this has been our way of working for 20 years, guided by and not limited by working with our values. Building an economy of trust within the community, which works miraculously it had worked during the COVID crisis. 3,000 frontline workers, and I'm proud, because we have been so careful that none has been lost as yet. So the government lockdown started in March, whereas Friendship prepared itself by the end of February. And we have about 1,100 only health workers in the front line. And we equipped them right in the beginning. We were the first actually in Bangladesh to equip all our frontline workers with proper gears. Because earlier on, when the pandemic started, by February, we had not had a case registered in Bangladesh till then. But my first concern was the safety and security of the staff, that no one must lose their job, safety and security of the communities, and to ensure that they had 2 meals a day, masks, isolation, knowledge sharing, immune boosters were put into place. All the resources were put into place. As soon as lockdown came, we went into action. And for example, 100% of our staff, the health reports were there. We were monitoring online much before the government had declared the lockdown, because we saw it coming. And, health, of course, helpline for staff, et cetera, et cetera. And we also needed to be prepared for natural disasters, because that was happening. And I think the most important thing is that we learned that preparedness without anyone having an agenda makes it possible to a large extent to deal with such emergencies and crises. And
I think that's a great message. Sorry, I was going to say that preparedness really comes through in what you were saying, and your description of Bangladesh's situation as facing so much climate-related poverty and so much climate-related threats really comes through in impacting on its ability to engage and mobilize around this pandemic. Runa, stay with us on the call, and thank you so much for giving such a great explanation of how you and Friendship are dealing with things in Bangladesh. I want to turn, if I can, to Mr. Buen from Korea Telecom, and just understand from your perspective, from a technology perspective, Korea has really received a great number of plaudits in the global community for the way it's responded through contact tracing to this coronavirus crisis. Can you tell us a little bit about how the technology sector has helped to tackle this problem and how you're dealing with it now?
Okay, thank you, Adrian. Thank you all for having me today. I'm very glad to share the case of Korea's efforts to respond to COVID-19 by using ICT technology. As all of you are aware, Korea is one of the countries that experienced COVID-19 in January earlier than many other countries. Although we still have some ups and downs in the number of confirmed cases, Korea has entered into a relatively stable stage as people keep a close eye on and comply with the government's public health and safety instructions as their everyday priority. While the world is still fighting against COVID-19, Korea has been praised for its innovative responses and various measures to flatten the curve on COVID-19, which includes fast decision-making, prompt knowledge sharing, innovative approach of fast testing and tracing, and voluntary social distancing. To elaborate on that, in the beginning of the COVID-19 outbreak, relevant information and data of COVID-19 were efficiently disseminated to the public through mobile apps and web services to encourage early testing. Once the infection started to spread, the government immediately took an action on policy making, such as social distancing, self-isolation, to stabilize the situation. According to the knowledge sharing paper, the government has summarized the key success factors of COVID-19 response to what they call 3T, which are testing, tracing, and treatment, all based on the use of ICT technology. However, Korea wasn't always ready to respond to infectious disease until 2015. When Korea first had the MERS outbreak in 2015, Korea was not completely prepared to prevent the spread of the infection, resulting in 186 cases and 38 fatalities in Korea. It was the time that KT developed a digital tracing in cooperation with Korea CDC to track down the pathway of infectious disease and apply them to the national quarantine system. This digital tracing includes international and domestic mobility tracing. First, international mobility tracing using roaming data makes it possible to alert people when a person goes to an infected area. Second, domestic mobility tracing of common cases can support the epidemiological investigation because the confirmed person's memory is not always perfect, and they sometimes choose to hide information of their whereabouts for their privacy. And sometimes the confirmed person may decease before epidemiological study is conducted. In addition to this existing digital tracing, we are making every effort to advance our current platform to include AI-based monitoring and prediction and testing functions. Some of our work include, first, predicting the risk of infection in advance by self-check on their body condition, such as body temperature, headache, and coughing using IoT sensors, which will be conducted in cooperation with the Gates Foundation during the next 3 years. Second, creating a model to predict to what extent the infectious disease may spread, which could be further used for policy making. Third, collaborating with AI technology companies such as AI-aided chest X-ray interpretation companies to help early detection and diagnosis of COVID-19. So at this point, I'd like to once more highlight the significance of ICT technology, which I believe is the key to effectively responding to epidemics. And to add one last word, I'd like to end my briefing here by sharing an historical event of Korea. Last week, June 25th, was the 70th anniversary of the Korean War, and much has changed since then. Now, South Korea has transformed itself from a war-torn country into the one that is leading a war against the global pandemic. This war against what is causing a grave danger to the public health in every country must be won. Finally, I would like to emphasize the importance of collaborative efforts across industries and countries to overcome the global pandemic situation. Thank you very much for listening, everyone.
Thank you for that, that fascinating briefing on what Korea has done to stay ahead in contact tracing. We have some questions from journalists on the call, and I'm going to start, if I can, with CNN Philippines and Carolyn Bonquin, who I think we have just on the phone. Carolyn, are you with us?
Yes, good afternoon.
Great.
Yeah, I have a couple of questions. My first question is, in the Philippines, an economic manager recently suggested a reopening of business establishments and imposure of village and company-based lockdown instead when a spike of COVID-19 cases in a certain area is reported. So how should the government and economic managers weigh in between health and wealth when it comes to, fully reopening the economy?
Thanks for that question. I'm going to turn first to Dr. Kasai. We've seen government responses go from national level lockdowns to more recently location-based lockdowns. Is there a perspective from the science on the effectiveness of those strategies, or is this remaining a matter of government policy?
Thank you very much for that question. First, I wanted to reiterate my statement. As far as the virus is circulating somewhere around the world, in this interconnected world, no country is free from the risk of infections. Therefore, we really have to find the way to live with this virus. And we call that as a new normal. And this new normal isn't about either controlling infectious diseases or bringing the society or economy back. It's a false dichotomy. We have to bring it both together. Again, this virus, there's still so many things we don't know, but we notice that those movement control, physical distancing has a certain effectiveness in controlling these diseases. But in the same time, we have to find the balance to bring back this economy and societies. And every country is trying in their own context, what is the best way to bring those both sides back. And one of the options to try out is, instead of making a big lockdown, try to identify where the infection is occurring and try to contain that location is definitely one of the options. As we all learning as we go, so I think we have to really, really try and see whether that is the effective ways to control these diseases in Philippines, but in the same time to make sure that the economy and society can come back.
Thank you for that. And perhaps just briefly turn to Mr. at the Asian Development Bank. Is there any evidence that the bank has and your economists have that local lockdowns are in a way less damaging to economies than the national level lockdowns, or is it too early yet to say?
Yes, this question actually we have to rely on the experts from the WHO and the CDC to advise. From the economic perspective, lockdown is bad, right? So if there's a way to open even partially, that should help. But the decision has to be made based on the science and knowledge on where we are in the country as well as in the specific location.
Thanks for that. Turning to our next question, we have Kamarul from Astrawani. Kamarul, can I turn to you for your question?
Sure, thanks, Adrian. Hi, everyone. It's afternoon in Malaysia.
Can I just ask you, Kamarul, to check your microphone, because it's a little hard to.
Can you hear me now?
I can hear you now.
Okay,
Yep.
okay, thanks. Yeah. So my question is, knowing what we know now, based on COVID, yes, it's true, Dr. Takashi said there's a lot more that we don't, but we have known many things also by now. Knowing what we know, what can we do more effectively and different if we only work together and not fighting this from each of our own countries or institutions? The reason I'm asking this is, Malaysia didn't do a lockdown. We did a movement control order, and we did both national and targeted ones. Those identified area with more than 40 cases, for example, is called a more tightened control order with barbed wires and everything like that. But I just am wondering, because Thailand, which is just north to Malaysia, has way more population than Malaysia. Vietnam even more so, but they have way lesser cases than us, and they took action early on in January. And Malaysia only knew about the severity of local transmission when one of the congregation of 14,000 people at a place near the capital city, 2 weeks later, because a participant from Brunei was tested positive in Brunei, and Brunei health authorities communicated it back. So now that we know all this, shouldn't there be a better multilateral platform, not only between government, but also across institutions? And maybe WEF can help champion this. So that's my question to all the panelists. Thank you.
It's a great question. And the ASEAN region has a number of pan-regional institutions. Dr. Kasai, is coordination at regional level something that might help in future pandemics as we emerge from this one?
Thank you very much. Actually, this is a very important question. Actually, after the SARS 2003, to help countries sharing information became one of the very important agenda. And we revised a rule called International Health Regulations. And basically, in line with these international health regulations under this COVID-19, where the member states is sharing information each other. But you are absolutely correct. What I found is that not just the sharing the information of the virus, but it's also the information of the response. Which response looks working, but which response is not necessarily bringing a intended result. Those kind of informations are very, very important in this COVID-19 response. And WHO is trying to connect the member states in facilitating those information sharing, not just the information of virus, but the response they're really taking. I think your point about not just the government level, but should be also between the institutions, I think it's a very important point. And I wanted to really, really take note how we can also include those information sharing between the institutions who is involved in this COVID-19 response. Thank you very much.
Thank you. I want to turn next to ABS-CBN from the Philippines and to Christine Savillo. I think everyone would express solidarity with ABS-CBN right now in the situation they face as a great news gathering institution in the region. Christine, can you give us your question, please?
Thank you very much for that. The question is for Dr. Takeshi Kasai. How is the Philippines faring compared to other countries in the Western Pacific? Is it true that it has the highest rising number of new COVID-19 cases? A couple of Philippine media networks actually did a story on the WHO dashboard and the numbers on the rising figures in the Philippines using WHO statistics, but the Philippine government itself denied this. Connected to that, with a positivity rate of 7%, is the Philippines actually doing better? Is it right that the WHO recommendation is actually 5% positivity rate? And finally, what should the Philippines improve to curb the spread of COVID-19 here? Thank you.
Thanks for that, Christine. Some detailed questions on the Philippines for you, Dr. Kasai.
Thank you very much, Christine. I know Philippine government is working so hard to respond to this COVID-19. In fact, that the Philippines is one of the earliest countries to introduce the lockdown, and I observed a massive logistic effort, including a supply of the food to help people comply to this lockdown. And our modeling shows that this lockdown saved a significant number of infections and maybe also the number of deaths. I wanted to really commend the people of the Philippines who've been doing their part to comply this lockdown. But I'm also aware how hard it has been and people need to go back to their work. Unfortunately, the data present shows that there's ongoing infections. And after gradually easing a lockdown, we're also carefully monitoring the data. And then we're seeing it may be early signal or it may not. But for example, like a number of the hospitals occupancy is start to slightly going up. I think it's going to be a very important few weeks from now on. And Philippine government, as like many other government, they continue to improve their response. But I wanted to make three recommendations. Number one, I wanted Philippine government to continue to strengthen their public health systems, including identifying the case early and isolate and treat. But from there to do a contact tracing of the close contact and quarantine to stop the transmission. It's not easy, but it's so important. Number two, I want government to continue to encourage people to maintain their healthy behavior. This virus is transmitted from human to survive. So every individual has power to change the course. And we wanted government to continue to remind people that they do physical distancing, washing hands, coughing etiquette, stay home, or wear mask if you go out to the public. These are the actions, not just protect yourself, but your family, your colleagues, your friends, and the vulnerable, including the healthcare worker in the community. And thirdly, we want the government to continue to improve the surveillance system to detect the early signal and also identify where actually infections are occurring and communicate that to the people so that people can make informed decisions. WHO takes this very seriously, and my staff working around the clock, not just in the capital in Manila, but also in the front line, hands in hands with the government.
Thank you very much, Dr. Kasai. Can we go to the Straits Times and Shefali Reki? Shefali, can you give us your question?
Sure thing. My first question is for Mr. You mentioned about job losses that are happening, and it's currently your estimate is that it could be of the order of 70 million. Now, I'm just wondering, a lot of the projections here are saying that in the Asia Pacific, at least we should be on a guard till the end of the year or early next. What will that mean in terms of job losses? Are there any projections? And secondly, how many years of sustained economic growth will it take for us to return to pre-COVID levels in terms of employment? I do have another question for Dr. Kasai as well. And I was wondering, sir, if you could give us some kind of sense of where are we in the fight against COVID-19? Are we at the halfway point, or have we just covered a quarter of the ground, given that many countries have succeeded in flattening the curve? Or is it that we really still don't know?
Thanks for those questions, Shefali. That was a triple decker for our panelists. I'm going to start with Mr. If I may. And you did mention, I think, the figure of 167 million job losses in your earlier comments, but could you just address Shefali's points there on recovery?
Yeah, so if I heard the question right, she was asking about what would happen to the job losses if the lockdown continues for 6 months. Was that her question?
Yeah.
I believe our numbers are based on the 6-month containment. That in that case, it would be up to that number. But it's always difficult to estimate these kind of things. So I think we can still keep the number as the current estimate based on the 6-month lockdown, basically to the end of the year. And what was the second question again?
The second question was about the recovery itself, and
how long it would take? Yeah, how long it would take to recover?
How long before we recover to pre-COVID levels of economic growth?
Yeah, again, that's a very hard to answer, but economists can always answer these things, right? But as I mentioned, the next year's projection is about 6-point-something% from the low base of 2020. So, the rate of recoveries may be back on track if things go generally well by next year. But to catch up to, for the losses, it could take a few more years to make it up. So, and again, it really depends on, how many waves we actually experience and how quickly we learn from our experience through this first wave of a pandemic, so that we can minimize the multiple waves.
Thanks for that. Just perhaps briefly before turning to Dr. Kasai, Mr. Byun, Korea Telecom, obviously, you're in daily, probably minute-by-minute contact with your customers. What are you seeing in terms of the economic impact, and what are your projections going forward? Are you looking at a long, slow recovery, or are you more optimistic? Just need you to unmute yourself, would be great. We're just getting you to unmute, I think, so that you can just give us an answer on that. And perhaps in the meantime, while we do that, we'll turn to Dr. Kasai just on Shefali's other question. Dr. Kasai.
Yeah, thank you very much. Although we are observing quite a significant level of outbreak in several countries. If you see the entire world, still there is so many space for the virus to continue to spread. And I'm afraid, as I mentioned, that as far as the virus is circulating somewhere around the world, there's no country free from the infections. And therefore, it's very important for us to think long-term and to find a way to live with this virus.
Thanks, Dr. Kasai. Turning next to BBC World Turkish and Ilgin Yorulmaz. Ilgin, I think we have you on the line. Can we get your question, please?
Hello, hi. Hello, everybody. I just want to update, first of all, we have very strict travel and re-entry rules put in place here in Japan. Japan has basically banned travel to or re-entry from almost 120 countries. Now, my first question is to Dr. Kasai. When we have all these travel bans, what would your recommendation be to countries from, as far as in the east as Fiji or to Turkey in the west, who are trying to conduct their travel diplomacy, so to speak, travel bubbles, when it all depends on this reciprocity, of course, and on the courtesy of countries, for example, Japan, which is banning now almost 120 countries to enter. My second question is to Dr. What would you say to the seasonal workers, for example, from places like, again, Fiji, Vanuatu, and other small Pacific nations who rely on work in Australia, New Zealand, and who have been since the beginning of the pandemic been repatriated, but now are unable to return to these seasonal work? What would you tell to those people whose livelihood depends on this program? Thank you.
Thanks for that. Dr. Kasai, what is is there a solution in terms of coordination to the travel ban situation? Are the sort of so-called air bridge solution or the travel bubbles something that the WHO is helping countries evaluate?
Thank you very much. These items, travel, removing the travel restrictions, we have to address as similar to other non-pharmaceutical interventions, public health interventions, meaning we have to do as a risk base. We have to consider carefully the effectiveness of its intervention and the negative impact of those interventions, and also the social acceptance. You mentioned about Fiji. The Pacific Island countries is in my region, and some of the Pacific Island countries where they have a very fragile systems, the controlling border is really, really important measure for them to protect their people from this COVID-19. So therefore, each country needs to pay attention of those risks, the 3 points I mentioned, and I need to make a very careful decisions. And to make that decisions, we need some good understanding of countries, between the countries each other, about the situations of the ongoing epidemiology, and also the capacity each country has. And again, the more country has a capacity, the easier to lift those restrictions. And again, this is a very important point that we need a support each other to help those kind of capacity in the countries to be elevated.
Thanks for that. And Mr. Can I just ask for your contribution on the impact on migrant workers?
Yeah, so actually Dr. Kasai responded to a large part of that, because at the end of the day, migrant workers, if they can't travel, then they're stuck and they have no economic means. So one aspect is, hopefully things will improve in terms of coordination between countries so that safe bubble relationship can be established as quickly as possible. But in the meantime, the workers and individuals have to equip themselves with the knowledge on how to actually stay safe. The best way to avoid catastrophes, don't get this virus. So there's a lot of knowledge out there over the last, that we gained over the last 4 or 5 months. ADB itself, we've been working with almost weekly call with the WHO, CDC, and others, and we have actually learned a lot about what works and what doesn't work. And that's a tremendous amount of knowledge out there. So I think every citizens, no matter who you are, need to be equipped with this knowledge so that in the event the economy starts to open up in full or partially or through the bubble, when that happens, you continue to remain healthy with this knowledge of staying safe, with social distancing and proper hand washing, hygiene and PPEs and so on and so forth.
Thanks for that. And I think we can just go back now to Korean Telecom, Mr. Byun, just to get your sense as a real business with real customers on how the economic impact is hitting you and what your projections are going forward. Are you optimistic about the ability of Korea's economy to bounce back, or are you cautious in your assessment of what's coming?
We believe that identifying confirmed cases and quickly isolating them are much more effective to prevent the spread of the virus than imposing a lockdown. So we chose to fight against COVID-19 through an epidemiological approach. And as a result, we were able to minimize the damage from the economic losses and successfully manage the outbreak without a full lockdown.
Thanks for that. I think we have on the line Koichi Sazazama from the Yomiuri Shimbun. Apologies for if I mispronounced your name, Mr. Sazazama. Can you give us your question?
Yes. Yes. Hello. Can you hear me?
Yeah.
My name is Koichi Sazazama from Japanese newspaper Yomiuri Shimbun. My question is, Dr. Kasai, I'd like to know, this is a simple question. I'd like to know what happened at your regional office on December 31st. This means the beginning of the pandemic situation. And according to WHO's updated timeline, which announced yesterday, Western, I'm not sure pronunciation, and Western Pacific Regional Office picked up a media statement on these unknown pneumonia cases in Wuhan by yourself. I'd like to make sure you get informed or notified other entity or other organization or other country except the Taiwan. My question is, that's all.
Okay, I think that's relating to New Year's Eve of 2019. Dr. Kasai, anything you can tell us about that updated timeline?
Sure. Thank you very much for that question. After the SARS 2003, we have established systems to go around the world, internet, to find if there's any potential incidents that might threat the neighboring countries, international community, to pick up and then allow us to do the risk assessment. And also, we have country offices in several member states. They constantly monitor if there's any public information coming out, both central, but also from the local level, that shows some kind of potential outbreak that pose a threat to the international community. We gather that information and then we assess those informations. And that has occurred on that day. And I received those information from my number 2, that they found that Wuhan put those informations on their official site. And that's the time this region switched on the response to this COVID-19. And then on the next day, January the 1st, we start to clarify related to those events, informations to the Chinese authority.
Thanks for that, Dr. Kasai. I have a question here from the Associated Press from Victoria Milko. Victoria asks, what health and economic measures are being taken to prepare for second or even third waves of outbreak? And also perhaps, is there any comment from the WHO on reports about a new strain of swine flu appearing in China? Dr. Kasai.
Thank you very much. This virus, again, as far as it circulates somewhere around the world, in this interconnected world, no countries can escape from the risk of infections. And I also mentioned in my statement that there's still enough space for the virus to continue to circulate. So it's very important for countries to find a way to live with this virus. It's very important for all countries to keep vigilance and then prepare, continue to improve their capacity to prepare for the surge. Living this virus means we really have to find a way, both on one side, we continue to control the diseases, but also to bring back a life and an economy. And I think it's very important for us to really think how we can achieve this. And the key is to make sure that every individual play their part to maintain their healthy behavior, to protect themselves, protect their family, protect their colleagues, community, and then the vulnerable. And the key is for business sectors to try to find the way to operate in reducing the risk. And the key is for the government to come up with the policy to support those kind of efforts. And that's what we're looking for as a new normal. And I really hope that this new normal will become a routine practice. And if that happens, this new normal can be a platform for us to move into the new future. And that's the reason why we're really looking for the COVID-19, a new normal can be a dividend for bringing us into the new future.
Thanks, Dr. Kasai. And obviously, because of COVID-19, there is a kind of sensitivity now to any news relating to new or potentially threatening viruses. And news reports in the last week have emerged of a potential new variant of swine flu. Is this something that your team at the WHO are paying particular attention to, or is this a case of heightened sensitivity making people a little bit more scared of these kinds of developments?
Thank you very much. I apologize that you were including that as a part of the previous questions. Again, our systems also detect this outbreak. And we're now start to questions about this virus. Influenza pandemic is actually a infections that we are really preparing for, in addition to this COVID-19. And this influenza pandemic, now I think the COVID-19 response and then the preparations or improving the capacity through COVID-19 can be a very good preparedness for those new influenza pandemic. The current information is not enough for us to assess the situations, but we wanted to coordinate with the authority to make sure that we do a proper risk assessment for this new incident.
Thank you very much, Dr. Kasai. I have a question from Saria Alam at thepostman24.com, directed to Runa Khan in Bangladesh. She's asking for the recommendation in Bangladesh to control the spread of COVID-19. And just briefly, perhaps, Runa, if you could let us know the situation there and perhaps to the how it's hitting some of the poorest, most vulnerable people.
Thank you. Yes. Bangladesh is trying very hard. And unfortunately, because of the poverty level in many of these areas and also of the income loss, that is overwhelming the sense of death. And this is, it gets quite uncontrolled, though the government, especially in the remote areas also, and even in the cities, because people want to eat, and all the when people are coming in and having these massive crowds, it's not for fun. It's really for livelihood impacts. They're coming back for that. And this is where I think we need to step back a little bit and look at the preparedness side and also the development funding side, because development funding really needs to work in preparing communities so that they can stand by themselves. Because in a crisis like this, unless you can have an alternative income, unless you can, be able to carry the messages and to be able to have your own sources, at the community level, it's extremely difficult for the government in a country like Bangladesh to be able to have this, to be able to control with the livelihood issues. And it's also, we are having lockdowns, but then seeing the issues of livelihood, we step back. We are having lockdown in areas, seeing the natural disasters coming in, there is no way to prevent the lockdowns from happening. So it's a continuous crisis, which unless more educated funding goes in preparing communities, it's going to be extremely difficult for countries like Bangladesh to deal with crisis if this kind of a crisis keeps happening.
Thanks very much, Runa. We're almost out of time on this briefing that we've been having. I want to thank Woo Chung-eun from the Asia Development Bank for joining. Also, Byeon Kyun from Korea Telecom for being with us. Runa, our thanks to you. And I just want to give a final moment to Dr. Kasai from the WHO just to bring our briefing to a close. Dr. Kasai.
Thank you very much again for this opportunity. The 6 months has passed since the first report came in. There's still enough space for the virus to continue to spread. It's very important for us to continue to be vigilant and continue to prepare for the surge for this COVID-19. If we do this well, I think this new normal can provide us the foundations to move us into the future where we want. And I really wanted to work with all the member states around the world to look for that kind of new future. And again, thank you very much for this opportunity.
Thank you. Thanks to all our panelists, and thanks to all of you for joining this media briefing from Geneva. Thank you very much, and have a good rest of your day. Thank you.